Everyone. Awesome. Thank you, Kate. Hi, everyone. Thanks so much for joining us, and sorry for the delay. We wanted to make sure that the Doula Advisory Committee members just had a little bit of an opportunity to get to know each other, and be in an environment where we could see everybody's kind of square on the screen at the same time. So apologies to members of the public and other partners and stakeholders. We're really excited that you're here, and we're sorry we're a few minutes late. Thanks for being with us. All right, so we just completed introductions for members of the public. You can also see on your screen who our Doula Advisory Committee members are. We'll also be posting their names on our website, so for more information, we'll make sure that you have access to that as well. We are going to continue, just provide a little bit of a summary of who we've got in the room here. So again, you kind of saw everybody's names. And then we just took some of the data from the applications that you all shared, just to see kind of what are the perspectives that we have around this table. Whitney, you mentioned, making sure that we have representative, that this group is representative of the different perspectives. So really thinking about, are there things we're missing? We can certainly talk about that at future meetings as well, but wanted to be able to just share what are the different perspectives that we have around this table. So when we think about kind of the roles that folks are playing kind of within this system, we have lots of folks who are doulas, as you heard in introductions. We have some provider associations who are representing doulas or community birth workers. We have Health First Colorado members. We've got Medicaid regional accountable entities, hospitals, birthing centers, federally qualified health centers, primary care facilities, behavioral health providers, provider organizations with expertise in maternal health care. So again, we're really looking at lots of different perspectives from across the system represented within you all here. And then we've also got partners and public members on the phone and the call who are able to bring additional perspectives and expertise into these conversations as well. A little bit more in terms of member characteristics. So geographically, we certainly have lots of folks kind of in the Front Range area, and we have some representation from rural areas. That may be an opportunity for this group to do some specific kind of outreach to additional geographies. And then when we look at race, ethnicity, we've got a good spread of representation within this group as well. So these slides will be posted on the website and shared out with you all as well. So this information will be accessible to you. So I know it's kind of hard to process on a screen in 30 seconds in a large group meeting. But if you, as you're kind of looking through these, you notice any kind of glaring gaps in perspectives, feel free to reach out to us. We're happy to kind of have some conversations. And if there's additional folks that we need to bring on to the deck, we can certainly do that. Again, we're going to be kind of improving and iterating as we go. So this is one of those first opportunities. So I wanted to share just a little bit about the role of the DAC before we dive in. I think we've talked a little bit about this in the beginning, but again, want to make sure that we're really clear about kind of what we're doing. So the overarching goal, as we shared earlier, of the DAC is to increase access to doula services for Medicaid members. So that's really what the focus is, right? Is how do we get more folks access to doula services that are enrolled in Medicaid? So this group is going to be really focusing on making recommendations to HCPF regarding program administration to get to that overarching goal of increasing access. So the DAC is going to be sharing advice. You'll be sharing advice as a group. We'll talk a little bit more about the process for that in a moment, but sharing advice to HCPF regarding the administration of that benefit. So functions, programs, services, really looking at things that are, what's within the purview of Medicaid to be able to make decisions about what advice can we give them about specific ways that the program can be implemented in order to increase access. What the DAC is not, and I know we referenced this again a little bit in the beginning, but this is not a decision-making authority. You do not have the ability to promulgate rule or make federal or state policy changes, although based on those introductions, I really wish you did. So if anybody wants to go the policy route or the legislative route, please let me know. I will happily support you. But we're really focusing within this group on kind of what's within the purview, what's within the span of control of Medicaid and HCPF HCPUF to be able to make those recommendations. And then just a reminder, you all don't speak for the department. You speak for the Doula Advisory Committee, and you bring your own individual perspectives as well. So just wanted to kind of set that frame in the beginning. I also want to acknowledge, right, things like state and federal policy may come up in these conversations, and then we can have the conversations as a group on kind of what we'd like to do with that. If you want to make a recommendation or, a statement, we can certainly walk through what might be a way to do that. And we want our real heavy focus over the next 6 months to be on how Colorado is administering the Medicaid benefit. Any questions, concerns about that? Awesome. All right, so wanted to just share a little bit more also about roles and responsibilities. So we have a number of different kind of folks here. We also have members of the public. You should also be on this slide because you guys are really helpful and important too. So just acknowledging that. So DAC members, what we're asking for from you, we'll share materials with you in advance. Ideally further in advance than we shared them this week. We know we didn't give you too much time to look at slides or the agenda. So we'll get those to you a bit earlier as we get to future meetings. And then really what we need from you is active participation, right? You are on this committee because you bring an expertise and an experience that is going to be critically important for decision making and for advice and recommendations. And if we're missing any of those perspectives, then the advice or the recommendations aren't going to be as impactful as we hope they will, right? So there really is a huge power in this group. And so that active participation from you all will be great. In addition to bringing your own perspective, really thinking about, listening to others' perspectives, trying to listen to understand, making sure that we are kind of hearing from everyone on this committee. So that will be really important. And then last but not least, and again, based on the introductions, this is already true, but serving as ambassadors for the program, right? Really being able to foster awareness and support in your communities around this really important and significant benefit. In terms of GPS, so that again is myself and my colleague Kate, we are here to really organize, structure, and facilitate. We are not experts around doula benefits. We want to make sure that people are heard, that we can ask the right questions to get to kind of the right recommendations and decisions. We want to make sure we're fostering a respectful environment that values the diversity of perspectives that you all bring, right? That is not to say we will never have conflict in this group, but hopefully we can have respectful conflict and we can really work through some of those disagreements and really start to understand each other's perspective. We also will do kind of all the logistical stuff, right? So making sure we're capturing meeting notes, so you don't have to be taking notes as in addition to participating, decisions, action items, right? Following up and kind of threading the needle in terms of the meetings across the next 6 months. And then last but not least, we also have HCPUF and other state agencies on this call, which is really, really helpful. And just wanted to acknowledge they are on this call to be able to offer resources and information to support your work. So the HCPUF team or CDPHE are not going to be voting members, right? As we get into making decisions and recommendations, they're not going to be, a voice in that vote, but they are here to answer your questions. Make sure that you have the information that you need to make the decisions or make the recommendations that you are going to be making over time. Really moving through kind of the queries or clarifications that you have about, what is federal policy versus what is state policy, and where is there opportunity to be flexible and where is there not, right? So being able to share that type of information will be really critical. So I'll pause there for a quick second around roles and responsibilities. Any questions, concerns? Perfect.
Erin,
Yeah.
there is no questions or concerns, but I also wanted to share that other state agency representatives may be invited to some meetings, such as representatives from DORA or the Department of Insurance, based on conversations that we're having or topics for the agenda for that specific meeting. And so just wanted to add that.
Yes, thank you, Annette. Yeah, really, really great point. I think serving as a conduit to other state agencies or others that may be necessary for specific topics or specific conversations is really great. Perfect. All right. I know I already asked this question. I was one slide too early, but any questions around roles and responsibilities? Okay. All right, so we are going to jump into just some kind of basic operating agreements for this group. Again, we are not going to go through every single minutia detail about how this group is going to operate. We will be kind of behind the scenes putting together, some recommendations and guidebook types of things for you all to react to. And we want to make sure we've kind of got the critical structure in place to be able to dive into topic areas starting in February. So again, we're going to get to the work really quickly. And there are a few things that we want to make sure we have in place before we do that. So my colleague Kate is going to introduce this activity, but just wanted to kind of set it up briefly. We want to make sure that we have some understanding within each other around our group norms, right? So how do we want to show up in this space together? And what are those things that we want to hold each other accountable to in terms of creating this space where we can really dive into some really pretty deep conversation around the doula benefit. And, we know we're going to have lots of different opinions. We're going to have lots of different perspectives. And so really looking for, what are those frames where we can just, again, make sure we're level setting and going back to making sure that we have group agreements in place that are working for us. We can, again, tweak those over time, and it's really helpful to have some as a starting place. So really quickly, before we dive into the activity, just wanted to share, these are the norms that we used with one other group. Every group has their own, so these are not to like drive everything, but wanted to just have some examples. So things like be open-minded, right? Let's be equity focused. Let's be aware of intent versus impact. Let's be good to each other, be present, be candid, be courageous, be creative. So again, this is just one group's kind of iteration of group norms, but wanted to share an example of what those can look like. All right, Kate, I'm going to pass it over to you to introduce this activity. Should I stop sharing my screen or?
Yeah, and then I can share my screen. If you want to leave that up, and then I'll share my screen.
Okay.
Just to give some kind of background. So, as Erin had said, for the DAC members, you'll be participating in an exercise. I'll be dropping a link in shortly to a virtual note board, but we wanted to have a bit of a quiet brainstorming session that allows you to kind of drop your thoughts and ideas in there, and then we'll discuss and we'll use that information also to develop those group agreements, which we'll share at the February meeting, and then you can all kind of vote to accept those or make some final edits. So with that, I will take over the screen share. Hopefully you are seeing a screen that looks like a whiteboard. I just dropped the link in. To use the board, if you need to move around, if you right click on your mouse, you'll notice the little arrow turns into a hand. That lets you move the board up and down, side to side. And then to add your thoughts, if you just simply double click, it will create a little sticky note. You can start typing. If you need to make it larger so you can see, you can do that. And then if you need to move, like there's another note there. So if you want to move your note, if you just hover over it, that allows, and right click again on your mouse, that allows you to move the note. And then if you get lost, I sometimes will drop a note and I'm like, where did it go? In the lower left corner, you'll see the zoom. That lets you zoom in and out on the board so you can see the information. I like to zoom in when I'm working in this just so I can see the note I'm making. The other thing you'll notice is it is pretty much anonymous. This particular tool comes up with some unique names for people as they join. So that is kind of the overview. Before I kind of let you all loose on this, is anyone having trouble accessing this tool? Is anyone having trouble dropping in a sticky note?
Sounded like we may have had a question from someone, but you were very faint.
Sorry, does it work on a cell phone?
It does. It's a little more difficult to navigate. So if you want, you can either just pop off mute and share with us, or if you want to do it more privately or quietly, you can use the Zoom chat, and then we can cut and paste that information in there on your behalf.
Yeah, and I think for anyone who may be experiencing challenges with the board, same advice. This is meant to really facilitate getting lots of thoughts quickly to the extent that it becomes a barrier. Don't let it. So we're happy to use the chat. You can come off mute. You can send us an email. There's lots of different ways to communicate. So if this isn't working for you, feel free to use any of those other modalities as well.
Yes, absolutely. And I will actually stop my screen share. I know sometimes having multiple screens up that look alike can be at least challenging for me. So stop that screen share and be quiet to give you all a moment to get your thoughts down.
Perfect. Thanks, Kate. So we'll go ahead and just give folks, we'll start with 3 minutes. We'll do 3 to 5 minutes. We'll watch the board. So we'll come back together when we see things start to slow down. But we'll go ahead and just give you a few minutes of quiet to be able to fill in group norms that you'd like to see that within this group. Awesome. This is great. It looks like we're slowing down just a little bit, and there's still some really great content being added. So I'm going to go ahead and give you all just kind of a 1-minute warning to add any kind of final thoughts you're having. We'll leave this board open if you want to access it. We're actually going to use it for our next activity as well. So we'll make sure you still have access to it, but we'll come back together in about a minute. All right, so we'll go ahead and come back together. I'm going to just do a quick kind of review of the board. We'll do some work between now and the next meeting to kind of consolidate and synthesize as well. But I think just as we were looking through, as you all were putting words into this, I think there's some really clear themes around the content and insights that you're putting in here. So I think there's a lot, there's a whole grouping around seeking diverse opinions, really welcoming diversity, listening to understand, open-mindedness, practicing curiosity, right? So there's a really great kind of bucket there. There's another bucket around, remembering we're on the same team, practicing giving grace, respect all views and perspectives, keep it kind. So again, really thinking about, how we interact with each other and how we share differences of opinions, etc. There's, again, lots of really great things, and we're not going to get through every single sticky note because we want to make sure we get to some other things as well, but just wanted to call out some of these themes. Celebrating, right? I think particularly in groups that are mission focused, that we know the work that we have to do is big and heavy, and there's always something next. Celebrating wins, celebrating each other's strengths, sharing superpowers. Those are things that kind of called out. We also heard from folks, right? How do we make sure we're being effective with our time? So staying on task, being present, staying on topic, honoring the time and energy you've committed to the committee, being wise with how we use our time, come to meetings prepared. So again, there's lots of others on here. I just wanted to call out just some of those really key themes that we see across all of the different input that you all have provided here. So thank you so much for doing that. In terms of the next steps for that, we will be, sorry, I'm on the wrong slide. So I'm going to go back a few. Sorry, my Zoom people are over my slides. Okay, I'm back. So next steps for that, GPS will be taking kind of the work that you put, the content that you provided into the LucidSpark, and we'll be kind of framing that and reporting that back to you at our next meeting, so we can kind of look at kind of distilling down. We'll send that to you in advance, so if you have kind of wordsmith changes that you want us to make, we can hear those, and then we'll finalize those group norms for moving forward with this group. All right, so we're going to keep moving and do a couple more just kind of logistical items in terms of how we anticipate this group to operate. So we wanted to share a little bit just around the decision-making process, right? We know this is not a group of decision makers, and this group is going to be providing advice and recommendations. And so you will be making decisions, right, in terms of what you want to share out for those recommendations. So I think primarily, most importantly, we are going to aim for consensus on all of the DAC recommendations, right? Our best case scenario is that every single one of you agree on everything that we bring forward, right? And so that's awesome. That would be great. That's what we're aiming for. That may or may not happen with all of the topics that get brought to the DAC. And so really thinking about, in the event that consensus is not going to be reached, we have, differences of opinions and people's minds aren't going to change. We want to make sure that we have a process in place to handle that, right? And so the plan for this group would be that we would then use Robert's Rules of Order, which is kind of a voting, right? We're looking at, how many folks are voting for different things, but that we would also have a process to document dissenting opinions, right? So knowing that 15 of 17 folks voted for this recommendation, helpful. Those two other voices are not unimportant, right? And so being able to document kind of the rationale for why that is will be really important. It, again, also helps HIGPUF in receiving any recommendations, understand kind of what are the pros and cons of those recommendations, right? Not everything is going to benefit 100% of people. And so when we think about kind of policy in general, people are impacted in different ways. And so the more that we can acknowledge that, the more we can call that out and understand what that looks like prior to implementation, the more impactful your recommendations will be. So we'll make sure that we have opportunities to document any dissenting opinions. We've said this a bunch of times. I don't think it needs to be reiterated, right? The DAC is not, the final decision maker for HIGPUF. It's providing that advice and recommendations. And then we've also, heard from the HIGPUF team, right? If they're not following the advice, providing a rationale back to this group will also be helpful and important. So wanted to just kind of lay that out as a process that we can follow, again, with the aim of let's get to consensus, right? And the acknowledgement that there may be some cases where we're going to have to use a more formal process. And we want to make sure that we are reflecting transparently the decisions of this group and the rationale around why those decisions were made and the reasons that there are folks who aren't on board with them. So I want to pause there for a moment, just in terms of structure around decision making. Any concerns, questions? Okay. All right, so we also wanted to just talk about attendance. We know life happens. Obviously, this is another one of those. We would love to have 100% of members at every single meeting. That may or may not happen. Things come up. I'm shocked that Aaron just joined us from the hospital. So, you are not all required to do that. I just want to put that out there now. So, making sure that we have, again, a process for folks to provide their expertise and their input if you are unable to make a meeting. So we have opportunity. You can email feedback and comments. You can email that to the HIGPUF team. You can email that to Kate and myself. We can read that during the meetings. We can make sure that DAC members have that opportunity, again, to provide that kind of written statement of dissent if a vote is happening, what your vote is and why. That's able to be shared before the meeting or after the meeting. And then we also, as you all got to meet Ward briefly during this meeting, you all have the option to nominate a proxy to attend the meeting on your behalf. So if you are not able to attend and you have somebody else that you work with or that you trust in terms of kind of representing your viewpoint, you can certainly do that. We just ask that you send us a note in advance just so that we know who that proxy is. But we don't have any sort of formality around that other than just a notification and letting us know the name of the person who will be representing on your behalf. Any questions around attendance? Okay. One other piece that we wanted to share was just around compensation. So we know some of you work for organizations and this is part of your professional role and you're being compensated. We know that's not true for all of you, right? So we want to make sure that you are aware that compensation is available for folks who are not otherwise being compensated to participate in these meetings. So we've put some of the details here. We can also share the compensation PDF in the chat as well. We've shared that via email, but please feel free to request that compensation. It is available and it is there to support folks who, again, are not otherwise being compensated. We know your time is valuable. We know your expertise is valuable, and want to make sure that you are compensated for it. All right, so we get to use the Lucidspark one more time, which may be really engaging for folks and may not be for others. Use the chat if you would like as well. So the next thing that we want to do, and this is kind of the last major activity that we'll have for our meeting today, is we want to just hear from you on what are the topics that you really want to make sure that this group discusses. We may not be able to get to 100% of them, but we don't know that until we know what you want to talk about. We know HCPF has been doing some stakeholder engagement. You all have been participating in much of that. We know there's some key themes around standing orders and referrals and recommendations, liability insurance, the enrollment process, billing and claims, right? We have some idea, and you all as the DAC members, we really want you to be driving the agenda for these meetings. And so the idea for the activity that we're going to do now, we're going to jump into that same Lucidspark. And you're actually going to move to, I get my rights and lefts confused a little bit. I have to like hold up the L. You're going to move to the right just a bit. And there's going to be another prompt that's specifically around topics that you would like to discuss with the DAC. And what we're going to do is just ask you to do the same type of activity that you did with the group norms. Just input the things that you really want to make sure we talk about. Input the things that when you joined or when you applied to join the DAC, that you were hoping that this group would talk about. So we're going to let you go ahead. We'll put the link in the chat one more time. And we're going to let you go ahead and go into the link. And just input anything that you would like to talk about. There is also an option to provide a reaction to a sticky note. So if you see somebody else's and you want to just upload it, you're welcome to do that as well. That will be done by right-clicking, and you should see the emoji, and you can either put a thumbs up or any sort of different type of face. If people are having trouble with that, please let me know. The Lucidspark is going to be open just to DAC members. I know we've got some folks on the phone from the public as well. So if you are interested in kind of putting forward a topic for the DAC, feel free to put that in the chat, and we'll make sure that we're just tracking kind of where those are coming from, and make sure that they get into the mix as well. Sound good? Any questions on the activity?
The link I dropped in should open up to that particular part of the board.
Awesome. Thank you, Kate. Perfect. All right. Well, we'll go ahead and give you 5 minutes or so. We'll watch the board. If it's still moving quickly at the end of 5 minutes, we'll give you a few more, and we'll see you all again shortly. All right, so let's go ahead and come back together. I'm going to just pop us over to the board for just a moment. And we can take a moment just to look at the input that folks have had. We will leave this board open for the DAC members, so we'll send this to you as part of the follow-up notes from this meeting. So if you have additional thoughts that you want to put into this, if you're thinking about this meeting later tonight, and you're like, wait, I should have said this one thing, you can pop it into the board. You can also just send us an email, whatever's the easiest way to communicate. But just wanted to look really quickly because I think there's some themes when we look at this as well. So, thinking about opportunities for data analysis and measuring success of the program, demystifying enrollment was one that got a lot of thumbs ups, scholarships, promotion and outreach and communication. So thinking about kind of the marketing communications aspect of doulas, really wanting clarity on what are some of the challenges that doulas are experiencing, digging into kind of the coverages and the payment and the reimbursement for the services, How are we going to continue when the DAC ends? So again, some really, really great topic areas in here that we can make sure that we are thinking about and calendaring out for the meetings between now and June, and then thinking about long term as well. So thank you all for putting some initial kind of thoughts and input in there. There were a couple here as we looked at them. The HICPUF team was like, we could probably provide a bit of an update on this. So Annette, I'm wondering, do you want to give a quick update on the Doula Hub and the scholarships?
Sure. Hi, everyone. Yeah, thank you. And I appreciate everyone taking the time to put your brainstorm topics out there for us to consider moving forward. Just a quick update on a couple of these items. The scholarship opportunity that was presented by Senate Bill 288. We are partnering with 3 organizations in the community who will be able to give those scholarships out to folks that are eligible for them. And we will be making an announcement soon as to who those 3 organizations are that we are partnering with in the community. And as far as the Doula Hub, we definitely heard at the perinatal summit that we had in November, some conversations about wanting the department to set this up. And we're continuing to look at opportunities or places within the department where this could occur. We're doing some testing right now in an LMS system on a platform that we currently already have. It's maybe not going to be the ideal of everything that we could dream up for a Doula Hub, but it would be a start that we could build from. And so we'll continue to see how those tests go and continue to update you as we see if this is a feasible route to move forward with. And we're definitely looking forward to hearing your ideas. So thank you so much.
Thanks, Annette, for just providing a quick update on those things. Perfect. All right. Well, we want to be respectful of your time. Really, really appreciate the time that you all have shared with us today. And I want to pause just for a moment before we go into next steps. Are there any other kind of questions, comments that folks have before we close out today? All right, awesome. So just in terms of next steps, we will send out the calendar invite that we talked about a little bit earlier. We'll make sure that you have that on your calendar for that 3rd Wednesday from 12 to 2. We will also make sure that the meeting information is published on the website, so you should be able to go there to get up-to-date information as well. But we will be communicating that directly as well. We will also send out notes and the recording from the second hour today. And then we'll work on developing meeting materials for February based on all of the input that we got from you today. So I understand maybe this could feel a little unfinished, and it is. So just wanting to acknowledge, we will be kind of packaging and reflecting back that information to you in February. If you have additional thoughts, questions, concerns in the meantime, please feel free to reach out. Otherwise, we will be kind of packaging that all up for you and making some recommendations on what the coming months look like. I also want to acknowledge just a gratitude to all of you for being here. We had everyone here, which was fantastic. We are hopeful that that will continue as we move through the meetings. And again, just really, really appreciate everybody showing up and participating today. We will be diving deep into a lot of these different topics that you brainstormed with us today. So we will get into kind of the nitty-gritty around access to the doula benefits. I know today is not necessarily the meeting that was the reason that everybody joined, other than the introductions, because it's really nice to know who's here. It is just some of that structure pieces, but we will be digging into the work starting in February. So again, really, really looking forward to those conversations. Reach out with any advice, insights, questions. We're happy to hear them at any given time. For those of you that I have not had a one-on-one with or don't have one scheduled, feel free to reach out. I'm happy to do those. They're nice, just opportunity to have 30 minutes to get to know each other and answer any questions that folks might have about the council. Sarah, I see a hand raised.
Yes, just for the DAC members interested in compensation, If you want to be compensated for this meeting, please send that in sooner rather than later. And our goal is to get those out to you within 48 hours. So just make sure you're sending that to us. We've gotten a few already and we're keeping track of that, but just wanted to note that really quick. So if you want compensation for this meeting, please send it by the end of the week.
You mean send W-9 or?
W-9 and then like confirmation that you want the compensation. Because if we don't hear from you, we'll probably just assume you aren't pursuing that. So if we can get some sort of confirmation.
Okay, thank you.
And Sarah, does that just look like an email with the W-9 and a request
Exactly.
for compensation for this meeting?
Yep, just let us know you're interested with that W-9 and that's it.
Awesome.
And to the email that you can send it to that email that we've been communicating with you all with, which I can put in the chat again here.
Awesome. Thank you, Sarah, for putting that in. Perfect. All right. Well, thank you so much, everyone. We are going to give you 4 minutes back in your day. We may not do that in future meetings, but we will not use more of your time than we said. So just wanted to say thank you again. Really appreciate all of you being here, and we will see you all soon. Thanks, everyone.